Hi, I'm Doris Jepson, and in this video segment I'm going to show you how to set up a PCA 3 pump. In preparation for this segment, you should already have read or viewed the introduction to the PCA 3 pump. You should also have reviewed the protocols for IV fluid administration and for managing controlled substances. You want to begin by checking your physician's order for the right drug, dose, route, the basal infusion rate if ordered, and a bolus dose if ordered, and a lockout interval. May also order a maximum 4-hour dose. Another thing that could be ordered is a loading dose. So there's a lot of things in the order that you want to pay attention to. You also want to double check your medication label against the physician's order to make sure that you have the right drug and the right strength of drug if that's ordered. As you can tell, we're following the 5 rights of medication administration for this PCA pump. Before you set up the pump, of course, you want to observe standard precautions by washing your hands, and you're going to want to set your gather your equipment together in the medication room and set up as much of the pump as you can ahead of time. You'll need a PCA pump attached to an IV pole. You're also going to want some IV fluids with their own infusion pump. The physician may order those fluids. If not, your facility may have a standard protocol for hanging an IV fluid of normal saline at a keep open rate of 25 milliliters per hour. The purpose of this is to flush the medication through the IV line into the patient when a dose is administered. The other items that you're going to need to set up this portion are your PCA key, which is a special key that only fits into this pump, and it actually locks the pump both onto the IV pole and it locks the door where the medication will be kept so that the medication is secure inside the pump. You'll also are going to want to get a PCA tubing set in order to set everything up that you need for the patient. So the first step for the setup is to insert the PCA key into the side of the pump, and you may want to move a little closer so that you can see. We're going to put the key into the lock and turn it forward, and that'll do 2 things. It will open up the door of the PCA so that you can put your medication in, and if for some reason you needed to adjust this pump on the pole or put it onto the pole, it has also unlocked the screw knob that attaches this pump to the pole. Otherwise, you can't turn that knob. It's locked onto the pole. So we have our pump open, and I'm going to go ahead and take the tubing and open up that bag. There's a couple items in here. One is the injector that we will attach to the medication vial, and I'll show you that in a moment. The other piece is the actual PCA tubing, and there's a long length of tubing, and that's what we're going to actually attach to the PCA medication. There's a shorter length of tubing. They're connected by a Y. Your IV fluids will be connected to this shorter length of tubing. You'll notice that there's a valve here. It's white. It's called a back check valve, and that prevents medication from coming into the tubing and backing up rather than going into the patient where you want it to go. The other piece to this tubing is just a short length, and that's what's going to attach to the patient's IV site. Let me take the injector out now, or the vial out now, and we'll attach that to the injector portion. Again, I've observed the 5 rights of medication administration, and I've made sure that I have the right drug. Today I have morphine sulfate and its strength is 5 milligrams per milliliter. To attach it to the injector, I'm going to take my thumbs and I'm going to pop off the ends of both covers that are protecting these things. Once those are off, I put them together and screw the injector into the vial. This now has formed a large syringe that we are going to use to connect to the PCA tubing. Again, this is a long length. It's coiled together right now with a piece of paper that can come apart at any time. We're going to attach that long length to the syringe we've created. So we're going to take the ends off of both of those, maintaining our aseptic technique, and we're going to screw that into place. So now this is all connected. There's a couple ways that you can prime the medication through that long length of tubing. One is you can set your vial down on a surface and you can gently press on it. And you want the fluid to travel all the way through the tubing down to this Y site. The other way you can prime that tubing is to put this into the machine and use the purge feature, and I'll show you that in a moment. Once we have primed that tubing, we actually can go ahead and now cut to a more close-up of the pump, and I'll show you how that is inserted into it. With this pump, you want to, you can actually turn it on a couple ways. I'll go ahead and press the on-off button, which is right down here. That causes the machine to come on, and it also goes through a self-test program, much like a computer does when it comes on. So while it's doing that, we're going to go ahead and insert our syringe into the machine. And we're going to do that by squeezing together the flanges on the cradle that are up at the top. Squeeze together, and we're going to move that clear up to the very top of this column. The vial has a couple features on it that when you hold one you'll be able to see quite clearly. Over here it has graduated markings that show how much medication or fluid is in here, and right now there is 150 milligrams of morphine, which works out to 30 milliliters. It also has a barcode on this side, and that barcode must line up with a window that's in the side of the pump. This pump will actually read the name of this drug from the barcode and will come up as that drug. So we're going to insert this syringe setup into the machine so that we have these markings facing forward so we can read them, and the barcode is facing toward that window so the machine can read it. So to put it in, you hold it at just a little bit of an angle, putting in the top slightly first, and you heard it click into these clamps.